Let's talk about the difference between the medical diagnosis given by the doctors and the nursing diagnosis given by nurses. Um, the medical diagnosis is the diagnosis of the disease. So it's given as a, like, let's say, let's take cancer as an example, right? So let's say breast cancer will be a medical diagnosis, a doctor's diagnosis. And then nurses usually have few diagnoses. There is one primary diagnosis, could be a couple of primary diagnoses given by, determined by a nurse, and a few secondary diagnoses. And what nursing diagnoses do, it's a clinical judgment concerning a human response to a certain condition, or maybe a lack of that response, given by a patient or a client to the condition. For example, in case of cancer, it could be lack of energy due to the effect of a chemotherapy. That could be one of the diagnoses. And let's say, or decreased cardiac output related to chemotherapy or radiation. Like, I mean, it is depending on the person's primary need at that moment. Their diagnosis could be varied, and as I said, there is a primary diagnosis and there are secondary diagnoses, and we go through different systems of the body and put let's say if their emotional health is affected, that one of the secondary diagnoses in case of this cancer, for example, could be even like a depression due to an impaired image. Often during the cancer and chemotherapy, people lose hair, and that could affect the person's response to the environment, like to the situation they're in, right? Like, and the treatment and all of that. So depressive, like one of the diagnoses could be a depression due to the impaired image. That is important. And what's the point of nursing care and comparing to the doctor's care? The doctors are focused on the cellular level to treating the condition and to making sure that it's these, the certain biochemistry parameters are according to the norm and blah 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 blah, from the medical perspective, versus nurses take care of a person in like the environment. So like we spoke about the epigenetic and the genetic. The epigenetic, that's what nurses are focused on, right? Like to make sure that the environment of their patient is optimal for the patient's survival and well-being. That's how I will put it.